already have the basics of ECG down, so we're not going to talk about P waves, QRSs, about the width variances. We're not going to talk about 0.08 to 0.12. We assume you guys know all that stuff, okay? So we're going to get into 12-lead stuff that's, like Jess said, a little bit more advanced after brief review of the electrical physiology of the heart, okay? One of the reasons that PASOFIRE came up with this class was because we wanted to develop a theory for emergency services for us, personally, for PASOFIRE on 12 leads in order to begin training our people. So the theory was for us that that a 12 lead is nothing more than an extension of our assessment. It's not delaying transport. So do you remember when the whole 12 lead thing came out and everybody said, I don't want to do a 12 lead on scene because it's going to delay transport? And we decided that that's unacceptable. We will do 12 lead on scene because we feel that we can train our people really fast to get a 12 lead. And I'm sure you guys have all done it out in the field. You can put the stickers on in less than a minute. Yeah, everybody can put on the patches in less than a minute. So that's not going to delay your transport. It's an extension of your assessment. This is another big thing. This is kind of a paradigm shift for paramedics. Choose to accept it if you like. If not, that's totally fine. For PASOFIRE, what we decided was we examined the question of do we diagnose out in the field. So what is your feeling about diagnosis out in the field? Do we diagnose? Some say yes. What do you think? Yeah, we absolutely diagnose in the field. The reason this was actually a question for us was because with 12 lead, now we can see chest pain from kind of a different viewpoint. Before, chest pain was chest pain, right? Everybody gets treated as chest pain. Now we actually have a tool where we can look at right side versus left side. That's a diagnosis, right? So when you look at the idea of what a diagnosis is, it's Merriam-Webster defines it as identification of disease or condition by evaluation of physical signs, symptoms, history, laboratory tests, and procedures, right? We do this all the time out in the field, okay? It's a diagnosis, that's what we do. Another reason that we did this was because we wanted both our EMTs and our paramedics to feel comfortable doing 12 leads. Okay, so not necessarily the interpretation of the 12 lead, but we wanted our EMTs to be in there patching people up so that that frees up the paramedics to actually do like some of the more ALS skills. Okay, and we want in early consideration of 4-lead placement, if we know that we have a patient that has some sort of chief complaint that will look as though we're going down the path of the 12 lead, we want our EMTs to recognize that and place the 4 leads properly, okay? So EMTs obviously have to be trained in this. And last was when we recognize that we have a certain type of heart failure, inferior heart failure with right-sided involvement, which we'll talk about later pretty in depth, we want to consider changing our treatment, okay? So that's not protocol at all. That's why you're going to see every single time I reference that, you're going to see these stars here. Not SLO County policy. We do not change our protocol unless we talk to the doctor. Absolutely something we have to talk about though. Okay? Okay, here we go. So 12 leads. So the 12 leads are obviously used. You guys have all done it probably 100 times out in the field or more. To diagnose STEMIs, bundle branch blocks, other ECG changes. We do this on a regular basis. You guys have all done it 100 times. This is the reason we do it. We want to facilitate early recognition so that the patient can get the proper treatment either through thrombolytics or PCI, percutaneous interventions, right? So go up through the femoral, grab the clot, pull it out, reperfuse, right? So that's why we do it. Why are we doing this class though? So we're doing it. We want to look at the lead locations for 12 lead. We want to talk about when to use a 12 lead and recognize ECG patterns for a STEMI. And then you guys are going to do lots of practice doing it my way. Okay, so when do we actually do a 12 lead? So obviously chest pain with equivalents such as what? So yeah, could be left pain, or left arm pain.